Everyone, thank you for stopping by my presentation. Today I'll be discussing phlebotomy, which is the art of blood draw. When we hear the words blood specimen, needle, injection, most people cringe immediately and they'd be running for the nearest exit if they could. Having blood drawn is not an easy thing for anyone. Just the thought of being stuck with a needle brings on instant anxiety for many people. So much that they'll put it off as long as they can. Well, if this sounds like you, have no fear, because there is hope. My name is Latasha, and I am a certified phlebotomy technician, and I am here to put your worries at ease. Today, I will educate you all on the practice of blood drawing, and I will cover the varied reasons why and when it would be important for you to have blood drawn. Phlebotomy is the practice of opening a vein by puncture or incision to remove blood as a therapeutic treatment. A phlebotomist is the healthcare technician who performs this blood draw. Phlebotomists may draw blood samples for test or blood donations. This practice dates back to ancient times in Egypt, about 3,000 years ago, and it was originally known as bloodletting. This was a practice of removing an excess amount of blood in hopes of curing an ailment a patient may be faced with. However, this practice reached its peak in the early 19th century, then subsequently declined. Anyone, male or female, can become a certified phlebotomy technician. You must possess a high school diploma, complete an accredited training course, and sit for a licensing exam. Once trained, you will see that the process of drawing blood is actually quite quick and seamless. Of course, this will not always be the case, as every patient is different, but for the most part, you will be in and out. Pun intended. First, you will verify your patient's name and date of birth. You will also verify the types of specimens needed. By this, I mean specimen tubes. Each tube is color-coded for different tests, and some tubes even contain additives to preserve the specimen, so it is very important to always ensure you have the correct tubes. Lastly, you will also need alcohol pads, cloth pads, and bandages. This is especially important because you never want to stick the patient any more than necessary. You will also need a tourniquet, which is like a rubber non-latex cord that's usually tied off at the top of the patient's arm to temporarily constrict the blood flow, just long enough to get the specimen. A specimen can be taken most commonly from a vein around the elbow. After wiping your insertion point with an alcohol pad, at insertion the patient will feel a slight prick. It is important to not go into the vein too deeply. You will insert your tube into the other end of the syringe, and the specimen will automatically begin flowing into the tube. You will fill your tubes up to the line indicated on each. Once completed, you will remove your needle, dispose it into the proper sharps container, and cover the insertion point with a clean and dry cloth pad as you simultaneously remove the needle. Be sure to apply pressure to help stop the blood flow. Lastly, you will apply your bandage. After about 10 sticks, this process will become like second nature. It is important to label your tubes accordingly to avoid mixing up or losing specimens. Anyone considering this profession must be kind, friendly, and lighthearted. It is up to you to reassure the patient that everything will be okay. 9 times out of 10, if they see your confidence, they will feel a lot better about the process. It's okay to smile and make the patient laugh, tell them a joke, or carry on a conversation with them to keep their mind off of what is happening. This will lighten up the mood and relax them. Some precautionary measures should be taken by both patients and healthcare providers when performing blood draws. Patients should drink plenty of water prior to having their blood drawn. Some tests are fasting, meaning nothing to eat or drink 8 to 12 hours prior, so it is important to verify this with your healthcare provider. But generally, water is okay because it helps hydrate the veins and increase the blood flow. Patients should also get plenty of rest and avoid smoking or drinking before and after blood draw. It is important for healthcare providers to verify if the patient experiences syncope, which is fainting, while giving blood, as this can be dangerous to both the patient and the healthcare provider. It is also important that only certified professionals perform any type of venipuncture, which is another name for vein stick, because there are many risks at hand for those who are not trained. Improper sticks can result in abscess, infections, or even sepsis, which is blood poisoning, just to name a few. Also, needles should never ever be shared or reused, as this can result in diseases like HIV or hepatitis. Phlebotomy is necessary for many reasons. Blood tests are performed to check for diseases like STDs infection. It can also be performed to learn the the specific blood type of an individual, and it is routinely performed on patients who are diagnosed with certain diseases like diabetes or high cholesterol. Blood specimens are also collected for donation. Donated blood is used for other patients that may need blood transfusions from loss of blood. Blood testing is done on people of all ages, from newborns to elderly. Blood testing is performed in various locations to include blood banks, hospitals, doctor's office, etc. Including the 2 common diseases I've named above, routine blood testing is also done for individuals who may be on certain types of medicine. The levels of medicine are routinely monitored through the blood to ensure safe levels. This is common in patients who are on certain types of mental therapeutic drugs. Well, sadly, I've come to the end of my presentation, but I do hope that I have left you all with some knowledgeable information that will allow you to rest easy the next time you are up for a blood draw. With these tips that I have provided, you can better prepare and have less anxiety with this process. Although it is not always a fun process, it is truly life-saving. Through the art of phlebotomy, we can live healthier lives. I hope you all enjoyed listening to the information I provided here today, and I look forward to speaking with everyone again very soon. At this time, if anyone has any questions, please feel free to leave them in the comments below. Have a good day.